The Advanced Practice Registered Nurse, also known as a nurse practitioner. What is a nurse practitioner? A nurse practitioner is a nurse who has already achieved a bachelor's degree in science in the nursing profession and has decided to further their education in order to better care for their patients by obtaining either an MSN or a DNP. They can work independently or alongside a physician depending on what they do and what state they practice in. They are able to provide further patient care that an RN cannot. Taking a look at the scope of practice for nurse practitioners, they're able to order and interpret different tests, prescribe medications, and complete assessments and diagnose illnesses in both acute and chronic illnesses. They can do this in many different types of healthcare settings. NPs get a tremendous amount of support from professional organizations such as those listed below, the American Association of Nurse Practitioners and the American Nurses Association. These organizations are able to provide resources, advocate for NPs, promote educational advancements, and network through seminars and conferences. Something that these organizations are currently working for in the advocacy phase is to allow full practice in all 50 states for NPs. Right now, only about just a little over half of the states allow NPs to utilize the full scope of their practice and practice independently. So that's something that these organizations are trying to provide a big push for. Nurse practitioners are providers that are able to provide comprehensive care for patients over their lifetime. They are trained and can manage both acute and chronic conditions, as well as specialize in many different areas, much like physicians. Something I think the public is misinformed about is the vigorous education that NPs go through in order to utilize the full scope of their practice and practice independently. In being able to do this, they can greatly help the provider shortage that is affecting the entire country. To end and in summary, we can look at how the Cleveland Clinic defines a nurse practitioner, which is a nurse who has advanced clinical education and training that allows them to complete much of the same duties as doctors, such as performing physical exams, diagnosing and treating illnesses, and prescribing medications. These are the references I used to be able to provide the information to you guys on this presentation.